Hey, Dr. Douglas Carrata. So why is it that when you go to the operating room and you have a nasal surgery in the operating room, you always, and I say always, you always bleed more than you would if you did something awake in clinic? I'd love to tell you, it's because I'm such a delicate surgeon and I'm the Michael Jordan of surgery, and therefore my patients don't bleed. But and I hope that's part of it. I really do. I like to think that I'm going to get better all the time. However, it's also because of anesthesia. When you use general anesthesia, it makes blood vessels in your nose dilate, and that means they expand. And so when they get cut, whether it's putting a needle in or making an incision, you will bleed severely. And a lot of times, the surgery's over in the operating room when the nurse says, "Doctor, the surgery's over." Why do you say that, nurse? Your patient's lost too much blood. You ever wonder why it's so exhausting recovering from a nose surgery? You're probably terribly anemic. You probably lost a fair amount of blood in the OR. No one's ever told that. Hey, by the way, you lost 200 cc's of blood during your procedure. And then, heaven forbid, you get one of the most common complications after the surgery, which is a nosebleed, and you lose more blood. I say what's better is you have a procedure without general anesthesia where you won't bleed, you don't need packing, and you don't lose blood, so you won't be anemic. Your recovery will be faster. At the Modern Nose Clinic, you have a procedure on a Friday. You return to work or school on Monday. We don't use narcotics, we don't use packing, we don't use scalpels, we don't do any stitching, because we don't do surgeries, we do procedures. I hope that was helpful.